Over the last year, a variety of prescription drugs used for those with diabetes have started to be used by patients for weight loss. In fact, just last week, we reported on a new diabetes drug called Mounjaro, which in U.S. trials was shown to help those struggling with obesity to lose upwards of 25% of their body weight. That amounts to an average weight loss of 60 pounds. And while a lot of focus is now on these drugs, many Canadians have a lot of questions. How exactly does a diabetes drug help with weight loss? Should Canadians be worried about using a prescription drug for something other than its original purpose? And most importantly, what are the side effects? Joining us now to help answer some of these questions is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you for joining us today on Forum Daily.
Great to be here.
We know that obesity is a persistent issue in Canada, but how big of a problem is it?
Right. Obesity is really a significant concern in Canada. It's a pretty big deal. According to 2019 Canadian health surveys, about 27% of all Canadian adults are now dealing with obesity. So that's quite a large number. It's a huge problem that really has been steadily growing and is now really considered an epidemic. And of course, it's not just a minor issue. It has serious implications. Obesity is connected to a wide range of health problems like diabetes, heart disease, and certain types of cancer as well. So it not only affects individuals, but it also puts a substantial burden on our own healthcare system. So you can see it's a pretty significant challenge that we really need to address and improve the well-being of Canadians.
So how exactly does a drug used for diabetes help people lose weight?
Right. So this is very interesting. So they're quite multitasked in their approach there. These medications are designed to really target the root causes of weight gain in people with diabetes. So they can do certain things like make you feel less hungry, and keeping you fuller after meals as well, and even tweaking how your body deals with glucose and fat. For example, some of these drugs will help your body even manage blood sugar levels better, and then that improves your response to insulin, which can then lead to weight loss. They can also, go ahead.
No, sorry, go ahead.
Yeah, so they can also change how your body processes fats and carbohydrates, which then results in the fat piling up as well.
And what do you make of the results that have been reported for drugs like Mounjaro?
I think it's very exciting. I mean, 25% reduction in body weight, average 60-pound loss is no small feat. I don't think we've seen anything like this before. But it's important to keep in mind that these results come from very carefully controlled clinical trials. And oftentimes we see that the real world experience is very, very different. And we certainly need a lot more research to understand how effective they will be in a real world setting.
So should Canadians be concerned about using prescription drugs while still prescribed by a doctor for reasons other than their intended purpose?
I think that's a great question. So I think we should rightly so be skeptical about using prescription drugs for different purposes. Oftentimes, these side effects are what we end up using it for as well. But really, it's an approach of pros and cons. You sit with your doctor, we discuss the pros and cons of using this drug off-label per se, and then we have that discussion. And as long as everyone is quite informed about it, then you know the risks of using a drug aside from its intended purpose.
And what are some of the main side effects associated with these drugs?
You can have quite a bit of side effects here as well. So stomach upset, nausea, and having difficulty. But there's also a lot of concern about whether these drugs might cause a lot of other issues that are quite serious, including issues with the pancreas or even issues with the thyroid as well. Obviously, these are in the beginning stages of these drugs. So, the headlines tend to be very positive. But as we understand the serious side effects, we'll see how that balance goes with these medications.
So at what point should someone consider one of these drugs for weight loss as an alternative to diet and exercise?
I think it's a pretty personalized choice. The best is always diet and exercise, but also understanding that some people will try diet and exercise and try the right things, but still can't quite get there. And in those cases, these drugs might be quite appropriate with a discussion with your physician to say, I've tried the weight loss, I've tried the diet, I've tried the exercise, I'm still not losing weight, and I need to get all of these factors in control. How do I do that?
Thank you so much for joining us today.
Thanks for having me.